Today we're going to look at the images of cartilage and bone. We'll look at the different cell types that are there, the differentiation of the cells to make cartilage and bone, the extracellular matrix, and the different structures which facilitate structural support of the body. Thank you. Images of cartilage and bone osteogenesis. Hi, I'm Larry Johnson, a professor at Texas A&M University. If this information is useful, please consider sharing it with others and subscribing to the YouTube channel. What we want to do is talk about cartilage and bones and the function thereof. Now, there's a host of connective tissue. The mesenchymal cells give rise to a host of blood cells, which are connective tissue. They also give rise to cartilage and bone. And that's what we'll be talking about today. There's different types of cartilage. You have the hyaline cartilage, which is what's in your nose, in your trachea. You have elastic cartilage in your epiglottis. And you have fibrocartilage, which is where tendons and ligaments attach to bones. So if you look at cartilage, you can see that the cartilage is lined by a perichondrium. That is connective tissue capsule, dense, irregular connective tissue. And then you have chondroblasts, which are differentiating from these cells, and they give rise to chondrocytes, which are trapped in the lacunae. So this is a intracellular matrix between there. If we look at hyaline cartilage in the trachea, and we can see the cartilage in through there, the trachea, we have the perichondrium, and there's chondrocytes, and then there's a chondroblast, and then they give rise to chondrocytes whenever they get trapped. Territorial matrix is the matrix shared by different ones. Isogenous groups, where one cell is divided by mitosis to produce other cells with interstitial growth. So here we see the perichondrium, the interterritorial matrix, as opposed to territorial matrix. A territorial matrix is what's directly around individual cells. Intraterritorial is what's shared by other ones. And then, of course, you have this, the chondroblasts and the chondrocytes producing collagen, which is type 2 collagen associated with cartilage. So if we look at the first specimen that we have slide 39. So if we take a look at this specimen, 39, we'll be able to see the cartilage. So we have the cartilage on the edge, and we have the perichondrium, and these are chondrocytes. Chondroblasts will be at the end here. So we have the perichondrium, and you can see that at different places. Again, the perichondrium and differentiation of cells from the surface to chondrocytes, and then chondroblasts, and then chondrocyte is the product, is a cell that is trapped in this lacunae. So also we see elastic cartilage, which is located in the epiglottis. It looks very much like hyaline cartilage, except it has elastic tissue in through there. It too has a perichondrium that you saw. Here's some artifacts in through there. So if we take a look at that, we can see this is in the epiglottis, and we looked at it for the epithelial type, stratified squamous or respiratory epithelium. But if you look at it, you can see the chondrocytes in through there, and you can see the filamentous components in there, which are the elastic fibers. You can look at them again, see the kind of dark filaments there. These are the elastic fibers that we can see there. So if we take a look at that, and then if we happen to look at the airway, we can see that indeed the cells here have same type of filaments here, which is elastic cartilage. So we have the perichondrium, these are chondrocytes, chondroblasts will be right at the edge, lacunae is a space where it is trapped. So if we take a look at these, we can see that again. Here in an audio way, this is the airway for the audio ears. You can see the chondrocytes in through there, and elastic tissue is the dark structure that we see in the elastic bands that are located in that structure. So if we go back, we can see the elastic tissue, and then the next type of cartilage, it has no perichondrium because it's already embedded in dense connective tissue, and that is where bone attaches to a ligament or tendon. So this is your typical type 1 collagen and fibroblasts, and then here we can see for the fibrocartilage, they're actually in their own lacunae. They have their local territorial space. And if we look at the vertebrae of these, we can see some cartilage in through there, and we can see the fibrocartilage, which looks like fibroblasts, except they're located in their lacunae. So you see the chondrocytes located in there. Again, fibrocartilage into hyaline cartilage, dense irregular connective tissue of the perichondrium that we see there. And we look right in this area here of the vertebrae, we can see the fibrocartilage that's located. Fibrocartilage is all in through there. We can see the cells in the lacunae, dense irregular connective tissue here. This is bone. So cartilage, so you have bone, cartilage, fibrocartilage, this is hyaline cartilage, fibrocartilage, and then you can have the dense irregular connective tissue capsule. So we take a look at that, 17. We can look at that one, and we can look right over here at that area, and we'll be able to see the fibrocartilage that you see there. This is dense irregular connective tissue running through there, and here you see the chondrocytes located in their lacunae. So again, here we can see this is bone. So these are osteocytes as opposed to chondrocytes that were located over here. So hyaline cartilage, fibrocartilage, dense irregular connective tissue capsule that we have there. So also we see fibrocartilage in this specimen here. This is where you have a joint coming through there, and there we can see some nice fibrocartilage. What we see is type 1 collagen bundles run through there, some fibroblasts, but also we can see the lacunae of the cartilage. You can see them here. This is one a space, another lacunae, another lacunae, another lacunae, and cells are all lined up there. So if we take a look at that specimen, we can see that right here where here we see dense connective tissue. This is dense regular connective tissue where a tendon will be associated with it. And then here we see this is muscle cells developing that we see in through there. And right up through here we see the fibrocartilage. So this is the fibrocartilage right in through here and in through there that we can see, and it's in the same vicinity you had developing muscle cells as well. So you can see that these individual cells, instead of looking cigar shaped like a regular fibroblast, they actually are located in a lacunae that we can see there. So located in through there, we can see that, and here you can see the fibrocartilage location. You might compare the fibrocartilage to a tendon. This is your typical tendon here that we can see. You can see that long tendon coming down right in through there, and it's dense regular connective tissue with fibroblasts. But fibrocartilage is different in that each one is in its own lacunae. And since the type 1 collagen surrounds the type 2 collagen produced by these chondrocytes, you don't have a perichondrium. So you don't have a perichondrium because it's already surrounded by type 1 collagen. And so here we can see this tendon in this specimen that we see here. We can take a look at that, and we can see that there's the skin, and then this is the developing tendon. So these are fibroblasts. You can see nice fibroblasts in through there. See the cytoplasm of it, kind of cigar-shaped cells that you can see. So this is different from fibrocartilage. and fibrocartilage. At the end of this tendon, you might start to pick up some fibrocartilage. Actually, I don't see any here, but sometimes you can. We saw it on the previous slide. So that's what we're seeing. So in summary, we have different types of cartilage. You have hyaline cartilage, elastic cartilage, and fibrocartilage is what we have here. Different ones, and they all come from the same cells, same precursor cells. The same precursor cell also produce osteoclasts, which eats bone, chondrocytes, chondroblasts, and also osteoblasts, which makes down bone. Now, the function of bone is so that skeletal animals can walk upon the land and to help support the structure, skull, bone marrow formation, different things. So there are different cells in bone. We have the osteoblast, is the differentiated cell that lays down the extracellular matrix or osteoid. You have osteoclast, multinucleated fibroblast-like cell, macrophage-like cell that digests bone. And then once the osteoblast gets trapped in their space or lacunae, they become an osteocyte. So you have mesenchymal cells, bone matrix, and uniform bone matrix that we see there. So osteocyte is the osteoblast is trapped in its lacunae, and you can see those. The osteoid is a little kind of reddish, as opposed to bluish in the case of cartilage. So this is bone. In through there, you see the megakaryocytes. You can see the blood formation, and here we see periosteum, that is fibrous connective tissue that surrounds the bone. You can see it right there, periosteum, bone. In through there, these would be osteocytes as well. And bone does not grow by interstitial growth; it only grows by appositional growth. So you would have differentiation of cells here from in the inosteum and the periosteum that would differentiate to give rise to more bone. Here you see osteoblast laying down bone, osteoclast eating up bone, and a spicule of bone. Again, we can see that if we look at slide 36, this is 30. Well, you can see bone here. Anyhow, we can see bone. This is the osteocytes located in bone. I can't really see where we have some osteoclasts that's eating at the bone. I really can't see those, but we saw those on the previous slide. Here they are, here, and here. So I didn't bring that specimen 36 that we could see those on. So also, if you look at hyaline cartilage right next to bone, so this is bone here and this is bone marrow, and so we got the growth of the cartilage at the epiphyseal plate. So since bone doesn't grow from within, interstitial growth, but cartilage will, and use the interstitial growth for cartilage, and then it differentiates into bone. And so you have these different zones: zone of ossification, zone of calcification, hypertrophy, hyperplasia, reserve. So you have these different ones as this cartilage is differentiating ultimately to make bone over there. So we have the hyaline cartilage in different areas: zone of reserve, zone of hypertrophy, increased number, zone of hyperplasia. Hyperplasia is increased number of cells. Hypertrophy is the increase in size of individual cells. So you increase the number and then the size of cells. And then you have osteoclast. There's an osteoclast right there. You can see it there, multinucleated thing that will eat down cartilage and bone. And so the cells, the osteoblasts, are trapped in their lacunae. And this is non-diffusible. And so they have to get nutrients from one another through these apical canaliculi. So these canaliculi project out between adjacent cells, and you have the osteocytes continue to touch one another, and it's through the gap junctions that of the cell projections that run through the canaliculus that allows it to get nutrients. So this compact bone, this is spongy bone that we see in there. Here we see compact bone, and we can see the osteons, which is each one of these circled there. Haversian canal running through there. The Volkmann's canal is running through there. You have inosteum and periosteum, both of which you have differentiation of cells to make bones thicker, and so you have inner circumferential lamellae or the outer circumferential lamellae, which resulted from differentiation from the perichondrium or the periosteum or the inosteum. And so here we see one of those Haversian canals. So this is the same as that, and you see the different layers of cells. Actually, they develop from the outside in. So these cells are younger than those cells, and you can see the little canaliculi which project from one cell to another. See little canaliculi that you see there, concentric lamellae that's through here. As I mentioned, they're older on the outside, younger on the inside. And so we can see that on slide 19. This is the Volkmann's canal and then Haversian canal, and then these are the spaces. The dark is what we see as space, lacunae, and the canaliculi. So if we take a look at this specimen, we can see there's bone there. I don't know where my specimen is. Let me see what that number is. If we go back here, that is number 19. So I'm going to have to go here and look for number 19 right there. And we take a look at that specimen. We can see the bone. And these are the Haversian canals. This is the osteon. And you can see the canaliculi, the concentric rings, the Volkmann's canal that connects, or connecting canal that connects from one to another. And these canals is the source of nutrients that go through there. So one nutrients is coming from the inosteum, and then it diffuses out into, not diffuse, it passed through these canaliculi and gap junctions between adjacent cells. So that ends the images of the cartilage and bone and a little bit of osteogenesis. We want to thank some of the people on this list that we use some of their original images in. Thank you.